Hey folks, today I want to talk to you a little bit about working memory, chunking, cognitive load, and expertise. So what I want to do first is just give you a little bit of a demo. Now this is a classic in psychology, so even if you've had an intro psych course, you may have seen this before. But what I want you to do is you can pause the video now, go grab yourself something to write on. I'm going to show you a series of letters, and what I want you to do is just read them, and then I'll say go, and I want you to write down as many as you can remember. Now I should tell you, the average person can remember 7 plus or minus 2 individual items in their working memory. So I don't expect you to get all of these correct necessarily, but we'll talk about this strategy here in a second for how you can get more. So what I want you to do, again, you can pause the video, grab something to write on. I'm going to show you the letters now. Ready? I'm just going to show them briefly, long enough for me to read them, so I assume that's long enough for you to read them too. Here we go. Go. Write down as many as you can remember. Okay, so you might need to pause the video now so that you can keep writing. That's fine. I'm going to assume you've pressed play again, and here we go. I'm going to show you the answers. So I'll show you the letters again here. All right, you could have also just rewound the video, I suppose. But the key to getting all of these letters is to notice that they are in chunks, right? So if you know these 4 acronyms, that's only 4 things that you need to remember as opposed to the 12 individual letters. Now, this is the concept of chunking, that we can take these sort of like individual little items and recognize patterns within them so that we can see more things, right? So we can actually really remember 7 plus or minus 2 chunks of information, not just sort of like these little tiny individual items. Now, this has huge implications for our lives. So first of all, this has to do with reading. So if I showed you a word that you had never seen before, maybe even in another language, you could process that as one thing, right? Especially if you knew that word, you probably would process it as one thing. But if, on the other hand, you've never seen that word before, you don't know that language, you're going to have to remember at least parts of that word, if not having to memorize every individual letter in order to remember it later on, right? So our language is based on chunking. So much of our worlds are based on this concept of chunking. So I'm going to give you a few more ideas. So out of the research, and we may have talked about this before, so this might not come as a huge surprise, but here we go with some spaced repetition. There's a classic study, and this comes out of the world of chess. So this is Chase and Simon in 1973. And they were looking at individuals who are masters in chess compared to those that are novices in chess. And what they did was they gave them the middle of a game of chess and asked them to memorize the board as quick as they could, right? So they gave them a little bit of time to look at the board, try to memorize it, and then try to recreate the board from scratch. Now, the chess masters did a fantastic job with this, whereas the novices did terrible. They got about 5 items, which is what we would expect for the average person to be able to do. So what they did next, though, was they gave the masters and the novices another board, but this time the pieces were randomly placed. So this isn't a real game of chess, it's just a randomly placed pieces, and they looked to see how they would perform. And now the masters and the novices looked exactly the same. So what this tells us is that the masters were processing this board as a chunk, or maybe a couple of different chunks, but that when they see this board, they see, that's the Queen's Gambit. That is everything I know about chess. But they see this board and they say, yes, that's the Queen's Gambit. And then it's easy for them to remember where many of the pieces on the board are just with that one chunk. Whereas the novices look at it and, like me, say, oh, look, a white castle and a black horsey, and try to remember where they are, right? So I would be processing that as individual items, but a master would be processing that in chunks. Okay, so this still feels a little contrived. Most of you are not chess masters. So how does this relate to you and your life? We're not talking about individual letters. We're not talking about chess. We're talking about everything. So when we think about a kid who is learning to brush their teeth, right? If you are a parent and you've ever dealt with this, it's like you have to remind them to put the toothpaste on. You have to remind them to wet down the toothbrush. You have to remind them, oh, you don't just brush the front, you got to brush the back of your teeth too. You have to walk through every single step. Oh, you have to rinse off the toothbrush when you're done. You have to do this, you have to do that. As an adult person who has done this repeatedly every day for the last years, now I process that as one thing: brush your teeth. And I remember all of those steps in sequence. I don't have to think of this step and then this step and then this step. It is a procedure that I remember as one thing. Okay, so somebody said, hey, make sure you brush your teeth, wash your face, and comb your hair today. That's 3 discrete things. For my child, though, saying, hey, brush your teeth, wash your face, and comb your hair is like 30 things, right? Because there's multiple steps for each one. Okay, so there are other things that this relates to. If you think about when you first started driving a car, right? You had to remember each of these different steps. Like, okay, my hands are at 10 and 2. I'm checking my mirror. I put on my seatbelt. Now, like, getting in and going is one thing, right? It's go get in your car, right? Go drive. And you don't have to remember this as separate sequence of events, okay? Recently, I was giving a talk to some medical educators, and they were talking about how in today's world, it's okay for students to be able to just look some things up. They don't necessarily have to memorize each and every little piece of information. And I don't necessarily disagree with that idea. But if they don't learn it, it can't be chunked. So there are some things where we really do need that foundational prior knowledge in order to create these chunks so that we can hold more things in mind. So as an example, as a new resident walking into an operating room, there are so many things going on, right? And so this gets to the idea of cognitive load. They don't know, they cannot pay attention to all of these things at the same time. There are monitors beeping, there's a patient on the table, there are people shouting things, there are tools everywhere, so many things happening simultaneously. And so how do they deal with that, like, overwhelming amount of incoming information? So as a new resident, each of those things is like an individual item, right? And so if we just think about the monitor in and of itself, we've got different things happening. We've got a temperature, we've got heart rate, we've got blood pressure, we've got all these things that are happening on that monitor. And as a resident, I would have to walk in and think about each of those things and like pull them together in my working memory and think about, okay, what does it mean for pulse to be this, heart rate, or those are the same, for pulse to be this, blood pressure to be this, temperature to be this? What does all of that mean when I think about the basic science and the diseases that I've learned about, right? But as an expert walking in, as someone who has been in so many operating rooms, I might look at that monitor and go, ah, okay, the patient is stable. Or, ah, okay, this is what's happening right now. I don't know, I'm not a doctor, right? But being able to chunk it in that way, the resident is going to be spending their time just trying to piece together those pieces of information, and they haven't even noticed that the patient is turning blue on the table, right? Because they're so overloaded. The expert is able to hold different pieces of information, right? They're able to hold like what the patient looks like, maybe the patient's history and the monitor and something else, all in mind simultaneously, because they're able to chunk that information, right? So instead of having these disparate pieces that they have to try to connect in their working memory, those things are already connected in their long-term memory. So it is really important that students gain that kind of expertise and create those sort of pattern recognition that comes with a lot of prior knowledge, a lot of really good foundational information so that the networks in their brain can be created. So this gets into one more topic that I want to tell you about, and that's the idea that the types of learning strategies that we use for novices and experts differ. Right? As novices who only have these like disparate pieces of information, or that we're trying to build up so that they learn these different pieces of information, these different facts, The strategies that you use for sort of acquiring new structures, right? For trying to create those knowledge networks to begin with looks different than what you do when those networks are already there. In the simplest terms, we go from more structure, more direct instruction, more scaffolding for those novice learners, and far more what we might call like creative learning, problem solving, constructive kinds of things for the experts. Okay, and this is in order to maximize both learning and efficiency of learning. It's not to say that you couldn't provide direct instruction for experts or that you couldn't allow novices to problem solve. It's just that they're going to not learn as effectively that way, right? And our goal is to try to make learning as effective as possible. So what we want to make sure that we're doing is thinking about the prior knowledge of our learners, and this isn't about age. Okay, so I have already admitted to you that I am a novice when it comes to chess, right? So if I was walking in and somebody was teaching me about chess, I would learn a lot more and a lot faster if somebody explained to me what the horsey is and what it can do, as opposed to if somebody just put me in the middle of a game of chess and I just had to like figure it out, right? And they were just like, oh no, you can't do that. And then I have to try again, right? It's going to take me a lot longer to learn that way because I'm a novice. Okay, so even though I am older, I can still be a novice in some topics. So that is critically what we're talking about here. It does mean that in many different learning situations, you can have a classroom of students who have the same prerequisites, but they come in having learned information differently. And some of them might look more like novices, and some of them might look more like experts. And as educators, that is really where we need to be thinking about differentiating learning so that we can take those novices, build those knowledge structures so that they are able to chunk that information and look more like experts. That way they can problem solve and think about a lot more information at one time. I hope this is useful for you. And as always, let us know if you have questions and we would be happy to answer them.